Yes, I appreciate your calling on me. Let me say that there are 6 community health center networks in my district. I want to mention them because they do a good job. Bronx Community Health Network, Hudson River Healthcare, Morris Heights Health Center, Mount Vernon Neighborhood Health Center, New York City Health and Hospital Corporation, Open Door Family Medical Center Incorporated. Together, they deliver high-quality care to nearly 500,000 of my constituents. Now, I've heard from some of these clinics that 2-year reauthorizations can hinder their ability to implement innovative care programs and retain experienced staff. And to that end, I'm pleased to co-sponsor the CHIME Act, a bipartisan measure which would provide 5-year reauthorization with increased funding. Let me ask Mr. Germano, could you please describe some of the consequences of short-term funding measures on a community health center's ability to implement care coordination programs?
Thank you for that question. As was mentioned before, the biggest effect is the paralyzing effect of not knowing what your future has in store. We're making long-term commitments to really change the face of delivery in our communities, whether that be the hiring of clinicians, whether that be creating of points of access. All those things take planning and investment. And when the dollars can only go out so far, most boards, most communities are going to say, we have to slow down or stop. And in some cases, we have health centers who ended up taking loans to meet payroll. We had others that rescinded contracts to providers who were coming because they couldn't guarantee they could afford them. It really has a very destabilizing effect with having such a short window like that.
Thank you. I appreciate your testimony. Let me also say that when we look at diabetes in my home state of New York, there are 2 million New Yorkers who have it. Costs the state an estimated $15 billion annually in direct medical expenses, and unfortunately, these figures are expected to rise as the diabetes epidemic worsens. To help turn the tide in this epidemic, Congress created the Special Diabetes Program. The program funds cutting-edge research into diabetes treatments and technologies, and New York research institutions have been awarded $86 million in SDP grants. Let me ask you, Mr. Kowalski, what are some innovative diabetes technologies that have been developed with SDP funds, and how are they improving diabetes care?
Thank you for the question. And first and foremost, I think what we've seen, as mentioned earlier, continuous glucose monitoring technology has played a pivotal role in driving better glucose control. More recently, artificial pancreas technologies are coming to the market, and the SDP program played a pivotal role in driving those into the American system much earlier than expected. And I can tell you that my brother and I use those systems very successfully with much better results. Ultimately, both in type 1 and type 2, people with diabetes, these advances forestall the need for the development of diabetes complications and those costly expenses. Both SDP and SDPI, both playing a critical role in slowing and reducing those costs.
Thank you very much. And Mr. Germano, let me ask you this. The United States has a growing shortage of primary care physicians, which is estimated to reach 50,000 by the year 2030. This shortage disproportionately affects underserved communities, and the Teaching Health Center program plays a vital role in addressing this gap. So, Mr. Germano, can you please describe how a 5-year reauthorization will help teaching health centers prepare the next generation of primary care physicians?
Thank you for that question. The 5-year authorization goes to that issue of stability. When we take a class in, we're committing to 3 years. So when we have 1 or 2 years worth of funding, it's a real leap to guarantee to these young people that we're going to continue to support them. The health centers are in underserved communities. Burgess, Dr. Burgess, mentioned that 70%, the data shows 70% of those trained in locations where they're trained land within 100 miles of where they're trained. So when we're training them in underserved communities, we greatly increase the opportunity to keep them in our communities. Our data shows 3 times more success than other kinds of models. So yes, we need teaching health centers in underserved communities, and we need to keep them there to take care of our communities.
Thank you, Madam Chair. Thank you so much for this. This is really important stuff that I know we both worked on, and thank you.